So welcome to another edition of the Cultivating Tradition podcast. I'm delighted to be joined by Dr. Hung-Rong Yen, who is an old friend and also the current dean of the Taiwanese Taichung Chinese Medical University. Hung-Rong, you've had quite an interesting and full career. I was wondering if you can let us know a little bit about your background so that the viewers can understand where you've come from.
Okay. Hello, Alex. Nice to meet you again. I have known Alex for a long time as a very long time friend, and I'm also glad to share some of our experience in Taiwan to many of Alex's friends and colleagues here in UK. So my name is Hung-Rong Yen. I came from China Medical University, Taichung, Taiwan. I'm serving as a dean of the College of Chinese Medicine at the CMU. I'm a Western medical doctor as well as a traditional Chinese medical doctor.
Thank you. So it's interesting actually in Taiwan that you can train, in your training, you have the option. Actually, maybe if you just explain the stages of training in Taiwan, that would be quite interesting. There's 7 years total, isn't it?
Yes. So in Taiwan, we have the higher education in Chinese medicine. So usually high school graduate, they can enter the School of Chinese Medicine, which will take like 7 years for the total education. And then in the last year of their study, they also need to do an internship in a hospital for the TCM internship. And after graduation, they also need to receive 2-year postgraduate year training. There's a so-called PGY training in Chinese medicine if they want to practice and have their own clinic in the future. And for many of our students, they also want to advance their career to be a TCM medical doctor in some of the medical centers or hospitals in Taiwan. So they have to receive another additional 2 to 4 year clinical training in different subspecialty, such as TCM gynecology, internal medicine, acupuncture, or TCM pediatrics.
That's really interesting. One of the things that we don't have really many structures for at all in the UK is that career progression. So when we graduate, that's it. We're let out into the world and we have to make our own way and find our own training. So it's really interesting for us to understand that Taiwan has this very supportive hospital structure and progression structure. And in that, I think in that 7 years, it's broken down. You have, is it 4 years is the first component? Is that right? And
usually for the first and the second year, they will have a general education as well as some of the basic knowledge in Chinese medicine theory and also Western medicine theory and knowledge. And then starting from the year 3 to year 4, until they will have a more in-depth learning in different aspects. And then later on, they will also have the education in a clinical specialty in year 5 and 6. And some of us, and for our students, they also need to receive the clinical clerkship in Western medical department in year 6. And then in year 7, they will do the TCM internship in the hospital.
now, when you did your training, you did an extra bit, which meant that you could actually become a fully trained Western doctor as well as Chinese doctor. Is that right? Yeah.
Yes. So every year, those who enter our School of Chinese Medicine, some of them, so this is a very highly selective. Like half of them can also do a double major in Western medicine. So, for example, I also did my double major during this 7 year. So this also means that every year is more like having 3 semesters instead of just only 2 semesters.
Right.
I have to learn more about Western medical knowledge, and also fulfill my clinical observation and clerkship in a hospital for Western medicine. Yeah.
Wow. When I first met you, you were talking about, you had a lecture about how you work together in oncology in an integrative way. Was it right that you had an office next to an oncologist and you would work together on oncology patients?
Yeah, actually, not only on cancer patients. So, in our university hospital, we provide this kind of a joint clinic for different subspecialty. For example, in the children's hospital, I also see the same patient with our pediatrician to treat the same patient. So, for example, those who have asthma, when they come to our hospital, they can come to see a TCM doctor, and then I will also refer the patient to see the pediatric allergologist if necessary. And so we have this kind of referral between each other very often. Even in the inpatient department, our Western medical doctors, such as a neurologist or neurosurgeon, when they have the patient who have stroke, after the emergent care, they will also consult our acupuncture doctor to do acupuncture treatment for this patient. So it's more like traditional Chinese medicine is also integrated into this healthcare system as a team member of the whole person care.
It's something that I think, certainly when I hear about Taiwan, in my experience seeing how Chinese medicine is practiced, it's kind of our dream. We'd love to be there in this setup. So as you also mentioned, you worked in pediatrics, and one of the other things that you did was did you set up the research center in Taiwan? Were you one of the founders of the research center? And maybe you could tell us a little bit about the research work you've done.
Yes, so I was recruited to CMU, which is also my alma mater. So in 2014, we established this Chinese Medicine Research Center, which received funding support from our Ministry of Education. So every year, we receive $1 million funding support to conduct research in acupuncture and Chinese herbal medicine. And we have a quite fruitful result, and try to conduct high quality Chinese medicine research to support the continuation or the progress of the Chinese medicine in Taiwan.
And if there's someone listening who's interested, if you search for Dr. Yen's name on ResearchGate, you'll see a lot of the research that's come out of that research department. And one of the common types of study that you've done, is it correct to call it retrospective cohort study?
Yes.
Is that right?
Yeah.
And that's only made possible because of the system of digital information on the health cards in Taiwan. Maybe you can tell us a little bit about that, because it's very interesting that Taiwan records all of its health data, which can be used for analysis later on.
Yes. So Taiwan launched the National Health Insurance Program in 1995. And in the first year, only the Western medical treatment were reimbursed by the National Health Insurance Program. But then in 1996, all of the TCM treatment, including concentrated herbal granules in Chinese medicine, and also acupuncture and TCM traumatology trainer, were being reimbursed by the health insurance. So we are very lucky to have more than approximately like a 30-year data from 1996. So this National Health Insurance Program covered more than 99% of the residents in Taiwan. So everyone can go to see a TCM doctor or Western medical doctor without worry about the healthcare cost.
It's and all of the data is recorded, so a patient has a card. They'll bring that card to the consultation. They put it in the machine.
Yes.
And so firstly, it's very convenient for the doctor, isn't it? Because all of their health data comes up. So they'll have, maybe surgeries they've had before, or all the medical history.
Yeah.
But also what's recorded is all the herbal formulas. Also acupuncture points. They record which acupuncture points are used and things like that. Or
so let me explain this to you. So every insuree will have the IC card with the IC chip, and which can connect to the cloud system established by the National Health Insurance Administration. So when you go to see a doctor, you insert an insurance card and all of your information, including the past examinations and laboratory tests, and even your medication, including Chinese medicine, acupuncture, or Western medicine, will be revealed to the doctor, to the physician who are seeing you. But of course, this will get a permit from you first. So if the patient signed the permit, the doctor can see the past history and also past medical records of the patient. If the patient say no, then the doctor still will be able to recode the medical visit to the IC card, and then this will connect it to the cloud system. So the good thing is that it already covered 23 million people in Taiwan for about 30 years. So we can do a long-term follow-up of this patient when they go to see a Western medical doctor or Chinese medical doctor. So the good thing is that using this kind of retrospective cohort study, we can see whether if acupuncture or Chinese herbal medicine can benefit the patient.
And so these studies are I found absolutely fascinating, because from we can see what both the Chinese and Western medical interventions, you can do things like do studies on, are there herb-drug interactions, right? Because you can see what herbs are being used and what Western medicines are being used.
Yes.
And it's a rich pool of data, effectively.
Yes. So, for example, if a patient are using Angelica Cynic, like a tangui or a warfarin or aspirin, if you worry about this kind of interaction, you can also use the database to see if it will have any effect on the breathing disorders.
And does it also record the Chinese medical diagnosis as well?
No, unfortunately, because the WHO's ICD-10 so far didn't include the traditional medical diagnosis. But the good thing is that nowadays the ICD-11 has a traditional medicine module. And so all of the traditional medicine diagnosis, such as Qi deficiency, blood deficiency, nowadays is also available in the ICD-11. So in Taiwan, I think in most of the country nowadays are using the ICD-10, but the ICD-11 is now available. So I'm the one who is in charge of the project to implement the ICD-11 traditional medicine diagnosis in Taiwan. So hopefully in the near future, we can also have the TCM diagnosis when we retrieve the data from the big data set.
What are some of your, I mean, that's fantastic as well. Seeing going forward, I think that's exciting. What are some of the most notable findings you found, like interesting things that you found with the retrospective cohort studies?
Yeah, I think there are a couple of things that we can do from this retrospective cohort study. The first thing is that if you want to understand how many people are using acupuncture and which gender or which age and what are their preference for using acupuncture, you can use this kind of epidemiological data to understand the utilization of traditional Chinese medicine or acupuncture. But then the next step is that if you want to know whether if acupuncture can work, can benefit this patient to reduce the long-term complication because of the disease, or to improve their survival or things like this, you can determine what kind of outcome that you want to study and use this data set and select a good control group, like for example, those who didn't combine acupuncture use versus those use acupuncture for their disease. And the third kind of study that you can do is that from this study you can understand whether if acupuncture or TCM treatment will be able to reduce medical expenditure. So this is a more, for me, this is a more convincing when we want to persuade the government or to persuade the health insurance program to invest more on traditional Chinese medicine or acupuncture reimbursement. Because when we give acupuncture treatment for those patients who have OA, osteoarthritis, we found that it can reduce the medical expenditure. Patients will have a better function or reduce their complications, so that they do not have to receive the surgery or like osteoarthritis knee replacement. So I think this is so amazing. Using this data, we can also think about what kind of regulation or policy that we can persuade the government to do.
That's incredibly important. And one thing that I've been discovering in my position here is that proving that acupuncture works is one thing. I mean, and it is obviously useful to do, but proving that it's cost effective, proving that they're good outcomes, and also having trust in the professionals that are performing it, may be even more important. And so, the final question I wanted to ask you is that Taiwan has such a well-developed Chinese medicine sector, and it wasn't always that way. It's got better over time, I understand. It's not just because Chinese medicine is part of Taiwanese culture. People had to work to make these frameworks, to make it as professional as it is, and accepted. In many ways, the situation in the UK is still in its infancy. Do you have any advice for us on what are the important things that we need to focus on to move forward and gain that professionalization, that level of development that Taiwan has?
Yeah, I think there are a couple of things that are very important to be able to achieve the status that we have nowadays. The first thing is that you need to have a high quality education and also good postgraduate clinical training. Then you also need to do research. With the support of this kind of evidence, you will be able to go to the next step, which is even more important for the whole TCM industry, is the regulation. So if you can provide the good quality research evidence, you can also persuade the government, persuade the stakeholders to invest more in this field.
I think it's. I'm definitely coming to a similar position about this, and one of the key linchpins is having those good standards which are proven by good regulation. So we have the standards and then the regulation, and then that enables us to do the high quality research and to project ourselves more into that space where we can start to actually gain that more credibility. So it's really interesting to hear that's what your emphasis is. Yeah.
Yes. Yeah. Actually, our university was established in 1958. At that time, there was no TCM school in Taiwan until we launched this TCM program in a higher education setting. In the past, the people used to learn Chinese medicine from the teacher, from the master. And there's no quality control. So you never know how good you are in acupuncture or in Chinese medicine. It's all recognized by your teacher. Say, you're done. You finished your learning, so you can now become a TCM doctor. But until that, we put it in the higher education setting and have a more high standard or like a quality control of the education and the training. Then we train students like me with being able to practice Chinese medicine. When I learned Chinese medicine back to more than 30 years ago, my Western medical teacher told me, TCM is not scientific. And my Chinese medical teacher, they told me, Western medicine usually have a lot of side effects. Still, you see, even though it's in a higher education setting, back to more than 30 years ago, there are still some conflict. But nowadays, we overcome this kind of a conflict, this kind of fighting between Western and the Chinese medical doctors.
Amazing. I think that there is something that I think the phase that we are in the UK is we need a maturing of our profession. And that means building relationships and building that trust. And it doesn't mean, and also I know because I've been to Taiwan, doesn't mean that you lose the traditional authenticity and the benefits that you have from that kind of lineage training. It just means that at a certain point, it has to do something. It has to actually be professional, and you have to have the relationships with other people within the health profession, and you have to have good outcomes. It has to be measured in some way. So it's as I say, I feel that the direction that Taiwan's moved in is really incredible, and to know that it came from very little in 1950 and it's built up to where it is. I think that we have to have that vision in our country too, that these things are possible, that we can move to something that's really inspiring. So finally, I just wanted to ask you about the master's program that you have for international students. I think that might be of interest to our members.
Yes. So I started to serve as the Dean of the College of Chinese Medicine at CMU 4 years ago. And then in our college, we have decided to provide a scholarship for international students who are interested in learning Chinese medicine or acupuncture in English. So we have this all English taught international master program in acupuncture or in integrative health. So students who are, this is only for international students, not for domestic students in Taiwan. So if there are any people here who are interested in learning in Taiwan, if they have your recommendation, I have to emphasize I need to have your recommendation later. I will give the 1 year tuition fee waiver to all these applicants with your endorsement.
It is an incredible opportunity. I think that if people even have the opportunity to come to Taiwan, visit the hospital and see the facilities and how things are run, it's a really great opportunity. But to actually have the chance to do a 2-year master's and immerse themselves in that framework and have that level of high training, I think it's vital that some of our members go to Taiwan and learn so they can bring back their experience and help us grow in the UK.
Yes.
So, well, thank you very much, Dr. Yen. You took some time out of your busy schedule. You're off to your next conference. But I hope to see you again, maybe in Taiwan in the future. But yeah, I'm very grateful that our members got to hear from you and some of the great work that's been happening in Taiwan.
Yeah, I'm also very happy to see you here and also share our experience to everyone. Thank you.
Fantastic. Thank you.